What's the common cold? Lower back pain is the #1 reason why so many Americans miss work every year. But new technology in treating chronic pain is helping patients reclaim their active lives. Here to tell us more is Dr. Araghi, orthopedic spine surgeon with the Core Institute. Good morning, doctor. Good to see you.
Good morning, Suzanne.
So many Americans can relate to chronic lower back pain. What's causing this?
Absolutely, and there's a lot of different causes for this disease entity, unfortunately. It could be an old injury that was never treated right and over time became chronic. It could be from degenerative arthritis of the discs or the little joints in the back called facet joints. It could be coming from a herniated disc or a disc bulge. And of course, last but not least, it could be coming from the sacroiliac joint as well.
And let's talk about the sacroiliac joint. What is it? How does this happen? And what, how many people know, like when do people know if they're being caused by this or this is what's causing their pain?
Right, so the sacroiliac joint is actually where your pelvis comes and meets the spine. There's little joints on the back on either side. And that's the area where it becomes inflamed and painful. As you can see, the pain distribution is, you would see on the picture on the right, shown out in the red portion. That's usually where the pain is. So the pain is not always in the midline of the back. It's a little bit off to either side. It can go down the buttock. And basically the way you would know is some of the things that make it worse is doing lunges or going up a step. As you're going up the step with that side of the leg, that could cause more pain. Or in bed at night when you roll over onto that side, that could also cause a pain. These are some of the signs of symptoms that differ between sacroiliac joint pain and pain coming from the spine itself.
And if someone suffers from this, I can imagine it can be debilitating to them. So what kind of technology do you use and how do you treat this?
Well, at the Core Institute, we have a very holistic approach to back pain. We have conservative care specialists, we have interventional pain specialists, we have physical therapy. So we always start with the simple stuff, physical therapy, anti-inflammatory medications. If they fail that and they don't get better, then we can always send them for some injections. Injections will help both treat the problem and sometimes diagnose the problem and make sure that's what we're treating and not something else. Last but not least, if they end up failing everything and there's no other options and the pain is debilitating, we do have this new minimally invasive technology where we can do the surgery in about an hour or less, and the patients typically can go home the same day, maybe the next. Overall, it's done very well for me. For the correctly chosen patients, they've done very, very well. The blood loss is very little. The chance of infection is extremely low. It's truly minimally invasive.
And we're talking about the Zyga technology. We're looking at right here. How does Zyga technology differ from other treatments that people may have heard of treating chronic back pain?
Correct. There are multiple different technologies out there that treat the sacroiliac joint. The distinguishing factor with this technology is that, as you can see, you put those screws in through tiny little incisions, but that red area around the screw, you're actually able to prepare the bone between those two surfaces and pack some bone inside to facilitate the growth and make the growth easier so you can get the fusion more definitively. And
what are the results that patients are seeing from this procedure?
Typically, the patients get significant pain improvement pretty quickly after the operation, to the extent that when I go see them the afternoon after surgery, they already feel a difference. They have incisional pain coming from the tiny little cuts, which is not severe, but they can clearly distinguish between the two, in most cases, not all.
And quickly, you were saying this procedure takes roughly an hour or so, and then where can they kind of get up and get back to their active life?
So usually we want them to be a little bit restricted in what they do in terms of sports and activities for about 6 weeks, but after that we allow them to do significantly more activities.
Doctor, thank you so much, because so many Americans, if you suffer from chronic back pain, I mean, it's just debilitating. So there's so nice to see that there's hope out there and they can get the pain relief that they need. So thank you so much for coming, and we appreciate it. And if you would like more information about Zyga technology, you can log on to their website, zyga.com, or you can call the number you see right there on your screen.